Hi everybody, welcome back to my channel, and today we have Melissa here that's going to help us with some pre and postnatal movements and tell us how we can get our bodies back moving again before and after we've had it. Okay, so what we're going to talk about first is some of the things that you need to keep in mind for prenatal exercise and some advice when you're looking at doing some of these movements.
Okay, it's very important, specifically if you haven't trained previously, so you don't want to get into like crazy movement during your pregnancy. My advice is rather speak or consult with your doctor to know whether or not it is safe for you to exercise. The other thing is that and probably the most important, you move according to how your body feels, okay? Don't watch videos and you see women who are like 7 months into their pregnancy deadlifting like double their weight or anything and think that you can do that. Every body is different, so don't put too much pressure on yourself with regards to movement and intensity of that movement, okay? It could be something as simple as a walk, a 20-minute walk, or just quiet meditative movement through yoga. Just stay away from hot yoga and anything that has you on your back for long periods of time. So you want to be very careful, especially during your trimester. So your first trimester, generally you will know more or less how you feel, so you can keep your movement to moderate. Just watch the intensity, and Steph and I will take you through the movements for that. In your second trimester, also be very mindful of your movement, so no heavy lifting. If you have a chair, I will show you a great at-home chair workout that you can do. Keep the rounds short, keep the movements slow, so no high intensity training whatsoever, okay? In your third trimester, I would say rather stick to like a short walk, or basically nothing that has you overexerting energy or putting too much of pressure abdominally on yourself, okay? If there's anything else that you guys need to know or want to ask, you can do so via Stephanie's channel, and we'll be more than happy to help you guys. Okay, we're going to start with prenatal, and the thing that you need to remember is your activity level before you fell pregnant and how much your body can move. So like I said, consult your doctor because every pregnancy is different, bodies change, so you want to make sure that you're doing what's good for you. In your first trimester, you want to keep your movement more or less the same as you were training, okay? And the only difference is that it will not be as highly intensive as it was. So stay away from hits. Make sure that your body is not overheating and that you're not lying on your back for long periods of time.
Okay.
So the best thing to do is incorporate your squats. You can do lunges, you can do glute bridges, and I will show you how to do push-ups. Okay, so Steph is going to be our little demonstrator.
Yay!
So the first thing we're going to do is squats, and if you have not squatted before, use a chair. All you're doing is sitting on that chair. So I want you to stand facing me.
Okay.
Knees shoulder width, legs shoulder width apart. Bring your hands out to me, okay? All I want you to do is sit. Watch your knees.
Okay.
Okay. So remember, when you're squatting, I don't want your knees doing this.
Okay.
Okay. So when you're squatting, I want you doing this.
Okay.
Okay. So you're going to use your chair as a guide. So you can go a little bit back. Okay. So all you're doing, hands up, sit. That's it. Up. Again. That's it. Again. Remember, keep your core tight. Squeeze your glutes when you're coming up. That's it. Movement becomes easier.
Yeah.
So you want to keep your reps, and that means how many times you do the exercise, between 12 and 15. The difference is you're going to be going slow and steady. There's no rush. This is not high intensity. All you're doing is keeping your body mobile. Okay? 2 to 3 rounds, and that's it. Okay, so the second exercise that we're going to do is a push-up. Remember, if you haven't done a push-up before, don't focus on getting up off your knees, okay? So what I'm going to demonstrate is how to do a normal push-up. So Steph, I want you to put your hands onto the ground.
Okay.
So I want you to stack your arms. So this is your arm, this is your shoulder, okay? You're going to stack your arms under your shoulder, okay, at shoulder width apart. You're going to cross your legs at the back, and I want you to pick them up slightly, okay? You're going to brace your core, okay? And all you're doing is bending the elbow. So that's it. Don't worry about how low you're gonna go. You're just bending that elbow.
Okay.
Perfect. Okay, so again, 12 to 15 reps, 2 to 3 rounds. Slow and steady, there's no rush. Perfect. Okay, another functional exercise is a lunge. So remember, when you're doing these exercises, especially during pregnancy, please do not focus on weight. Okay, it's about moving your body and getting your body mobile again. So basically, we know a lunge, all you're doing is stepping, and we're going to start with the right leg. All you're going to be doing is stepping out forward, that back leg, push it out a little bit, that's it. All you're doing is driving that knee almost to the ground. So hold my hand for balance. Okay, that's it. So you don't touch the ground, you're going almost to the ground, up again.
Okay.
Perfect.
Does your back foot heel lift up?
Feel for your body. Generally, if my hamstrings are tight, then I will keep my heel up. If your foot feels comfortable flat on the ground, keep it like that. Remember, when you're training, there's too many rules nowadays. We watch these Instagram videos, and we watch all these fitness things, and it's so confusing that you don't know actually what is the correct way of doing an exercise. Move to what your body is comfortable, especially during pregnancy. So whereas if you're carrying a lot of weight during pregnancy, and technically during your 3rd trimester, you shouldn't be doing all of this. You should be going for walks and keeping your movement moderate. So just long strolls, maybe some yoga, no hot yoga, no vigorous movement, no overheating of your body. So when you're doing your lunge, all you're doing is stepping out. Okay, my leg is flat at the back, and all you're doing is dropping your knee.
Okay.
That's all you're doing. Okay, remember, keep your core tight as you can. Okay, and focus on the movement. So you want 12 reps on either side of the leg and 2 to 3 rounds. Okay, for the last exercise, we're going to use a resistance band, and generally you can use weights, a very lightweight during your 1st trimester, but I feel like women are a lot more comfortable with a resistance band, and it's also much easier to use. Okay, it's not where you need to go into a gym and get a weight or actually go and buy a set of weights. A resistance band is also inexpensive, and it's probably the most functional equipment that you can actually own. Okay, so what we're doing is Steph is going to step on it. Hold it on either side of her.
Okay, thumbs up.
Thumbs up, and you're going to bicep curl. So all you're doing is lifting up. That's it. Back down.
I need to get me one of these.
They get pretty nifty, hey?
Yeah.
You can feel the weight. So remember again, 12 to 15 reps, 2 to 3 rounds. Okay, there's no rush. This is not a hit. We're taking things slowly. All we're getting is you're used to routine and to movement. Okay, and this can be used in your 1st trimester and your 2nd trimester. Remember, ladies, and I know that we see a lot of videos where women are pregnant and they're lifting heavy weights. I would say that you should move according to how your body feels and whether you've got the medical go-ahead and whether it's safe for you or not. My advice is, when you're hitting your 2nd or your 3rd trimester, please stay away from heavy lifting. Okay, the purpose of your body growing a human is functionality.
Okay, so another question that I'm going to ask you that is quite an interesting question. Not everybody likes speaking about it, but we don't care what everyone likes speaking about. So when you have a baby and you have a C-section, you are having a lot of medication and your body tends to get constipated. Is there any advice that you can give us, nutrition and movement wise, that can assist women with that?
Definitely. Listen guys, bowel movement is a normal thing. Okay, I don't want anyone to be afraid about speaking about it, especially after pregnancy. It is a problem. And with all of the medication, my advice is focus on your nutrition, okay? You want fiber-rich foods, so you want to look for whole grains. And I know it's a very difficult period because your body is craving all sorts of things throughout your pregnancy, that it almost becomes a lifestyle in that 9 months to feed your body things that you're essentially craving that might not always be the healthiest. But bear in mind that it takes also a longer period to recover if your nutrition isn't somewhat clean during your pregnancy or healthy. So if you are battling with constipation after you've had your baby, look at your foods. Rather opt for whole grains, couscous, barley, whole wheat. You can even use quinoa, you know, things like, stay away from refined grains. So white bread, white rice, anything that's high in refined sugar. You want to add more of your green superous veg in there. So broccoli, asparagus, spinach, loads and loads of spinach, because that's your iron. Just make sure that when you're eating, you're getting the benefits of your minerals and vitamins from that, okay? And I promise you, your bowel movement will be a lot easier. It sounds odd to say it in that term. If you are still struggling and if you need a little push, you know, we're so scared to speak about these things. So I'm going to demonstrate it quickly, okay, while we're sitting here. So basically, this is your toilet. Be comfortable, okay? So even if you have to get a little step, put up a step with your legs up, okay? And just breathe. Your diaphragmatic breathing helps you so much. So if you're still struggling, sit. It's only your baby that's waiting for you. Your hubby can wait, okay? Breathe. Focus on what you're doing. It's odd to say make the mind and movement connection, but focus on what you're doing. And just one heavy push, that should help you, okay? If it doesn't work, again, go back, look at your nutrition, try and get in fiber-rich foods, fruits, veggies, whole grains, limit your refined sugar, your refined grains. Just be mindful about the way that you're eating so that your body benefits from that. I hope that helps.
So the next question we want to ask you is, some women have wondered if they have passed their due date, how do they safely induce their labor?
Okay, the key word is safely. So the first thing you'd actually need to do is consult with your doctor, okay? Maybe they'll give you either a medicinal option, or if you want to do it at home, and I'll show you guys quickly. It's a matter of getting into a deep squat, okay? So with your belly, obviously past 9 months, wide legs, drop down. You'll immediately feel a gravitational pull, okay? Because of the weight, immediately you'll feel that pull. The breathing is very different. So whereas when you're in labor, you are heavy breathing. When you're trying to get some sort of control of your body or trying to gain control, the breathing is a lot deeper. So I want you to inhale. So when you inhale, you should feel the air fill into your belly. It's not generally a thing of where your chest rises and drops. Your belly should fill with air. So you want those long, deep breaths. Inhale, exhale, hold for about 2 to 3 seconds in that deep squat position. Remember guys, I'm not a medical practitioner. I train women pre and postnatal, and this is advice that, you know, I've given them and it's worked for them. So if you are keen or if you need any more information, please, information is so widely available. Just don't be misled or misinformed. If that is the route that you're going to go, rather speak to a medical professional and to your doctor.